could you let me know why, what is the motivation for this letter, and just in general, I guess your thoughts on the curfew?
Mm-hmm. Well, the league had already some concerns regarding the curfew last year when it was the first time we applied it, but we were still, I would say, swimming in like obscurity. We didn't really know what was going on. So I think it was, we had concerns at the time, but we still didn't want to be too firm about it and too vocal about it. But this year we are really concerned because there hasn't been any proof that the curfew worked last year to reduce the cases or to prevent the transmission of COVID. But also, there's also this huge concern that we have, and it's the effects that we know that the curfew can have on some really vulnerable. Sorry, I will just start that sentence again. So we know that there's also the curfew. But we know that the curfew also does have some really negative impacts on some really marginalized populations. I think, for example, people who are homeless, people who are using drugs, sex workers, even people who live domestic violence. We've talked about it a lot in the past year, and we are really concerned about women or people who would like to leave their house because they feel they're threatened. And we're concerned that the curfew is going to have really negative impacts on those people. So when we ponderate and when we see, we try to measure how positive the impacts could be and how negative it could be also. It's really hard to weight the two, the negative and the positives, and it's really hard for us to see how it would be a useful measure, the curfew. So it was really important for us this year, knowing what we know about the negative impacts and knowing what we know about, and knowing what we don't know about the positive impacts. It was really important for us to speak out about it because we're really concerned about how people can exercise their rights, and especially like security, rights to security, rights for life, rights for freedom of circulating.
I don't know if this is too dramatic to ask, but do you almost think that the curfew is a violation of human rights and just everyday rights?
Well, the curfew by itself, it is for sure a violation of human rights, because it can violate the right of people to go where they want, which is a basic freedom in a democracy. However, it can be justified for government to violate some rights in some circumstances. And in those cases, it's on them to justify actually why they are violating it. And actually, when they are doing so, they have to show how the positive impacts of that measure or of that right violation can outweigh the negative impacts. And this is why there's a concern for us, because we know since the beginning of the pandemic, there's been a lot of human rights that have been violated, but it was justified because of the pandemic. But we think that the curfew is not justified, especially because it has so many negative impacts.
Thank you so much for clarifying. So I have a lot of questions.
Okay, take your time. I have more time.
Where to start? I guess I kind of want to ask specifically on certain groups that are being negatively affected. Maybe first, I'll ask about homeless folks. I mean, I know that there was an issue because they were included in the first curfew, and then the government kind of addressed that. I mean, it's, to my understanding, they're exempted from this curfew again. But do you think that the curfew will still negatively affect homeless people?
Yes, of course. I think the curfew is going to affect negatively homeless people. I think even if there's an exception for people who live on the streets or who don't have a permanent house, those people are usually more arrested by police officers. They usually get more tickets more tickets regarding their way of living, I would say, and the fact that even if there's an exception for them, they would have to kind of show and demonstrate that they are homeless. I think this is really very victimizing for those people. Also, we have to think about the fact that right now, the shelters are really full for all the homeless people. So there's going to be people who will want to have access to shelters, but they will probably won't be able to do it because so many people will want to be inside. So I think it's really, we're putting the health of those people in danger, and we're also putting their mental health in danger with this curfew.
And do you think there's maybe something to be said about the curfew kind of creating over-policing, increased policing, things like this? Oh, I think you froze. I don't know if I froze. Okay.
Oh, sorry. Okay. Is it better now?
Yeah, it's good.
Okay, I can, because if you want to, I can plug myself directly in the wall if it's better for the internet connection.
If you
would you like me to do that?
If you want to try it out, if it's not too much trouble. Thank you.
The past weeks, but you never know. All right, so it should work better this way.
Perfect. Did you hear my question okay? Do you want me to restate it?
Could you restate it, please?
Absolutely. Thanks. So essentially, I guess, is there something to be said about the curfew creating over-policing, increased policing?
Since the beginning of the pandemic, we've seen a lot of repression and policing, and it's been increasing regularly since March 2020. And we've seen that it's not always, it does not really always have positive results on the transmission of COVID, for example, but also we're really concerned because it does have really negative impacts. And just in general, using repression to avoid actings that are related to public health are not really useful for the public health problems, but also it's not really useful. It's not really helpful, let's say, on a global scale in a society, because we know that there's reason to act fast, and we know that the government is concerned because we do see the COVID cases rise. Actually, they have risen. It's really high right now, but we're really not sure about the giving tickets to people who are walking their dogs outside at after 10 p.m. after the curfew, or especially people who would for example, would like to go to an injection supervision site to get their drug. We think that this is really going to create some stigmatization of those people, and this is going to make people who were already really marginalized by the crisis of COVID get more marginalized. And we've seen that there was this report published in May 2021, by CCLA, the Canadian Civil Liberties Association, regarding the number of tickets that were given for each province during the second wave of COVID. And we saw that the Quebec province was the second one giving the most tickets. And this is really concerning because we are going that way again. When we see that these tickets were given mostly because of the curfew, we are going that way again, and we are not sure if it's going to be useful for public health. And also, I think it's really important for us to remind ourselves that this is a public health problem. It's not a public security problem, and we need to address it as a public health problem. So we need to have people really being concerned about the propagation of COVID. But we really don't think at the League that the curfew is going to be able to answer that effectively.
Thank you so much. I just want to confirm, during the second wave, Quebec gave the most tickets, or second?
Second most, yeah. The first one was Manitoba, I think.
That's weird.
Yeah.
Because they didn't have a curfew. How does that happen? I'm just surprised because they didn't have a curfew.
In Manitoba, you mean?
Yeah.
Yeah,
So
I'm not sure why they, I guess it depends me because I didn't check what infraction
Mhm.
were giving it for in Manitoba. Maybe it was only like internet, like I know maybe personal meetings or something like that. I'm not really sure for Manitoba, but this you could ask the question to CCLA though. I'm pretty sure they know, but here in Quebec, it was mostly because of the curfew, and you can see that the number of tickets increases, like it started in January, and when it increases by the end of April, which is by the end of the curfew-ish, you can see that the number of tickets increased regularly during that period from January to April. And it's mostly curfew-related tickets.
yeah, that makes sense. Okay, I'll have to check that out. Wow, I'm just surprised it was Manitoba. Manitoba. So I guess on the note of policing, I just want to bring up the number. Where is it? I wanted to ask about your thoughts on, oh, sorry.
I'm there. I'm still there.
I was switching around windows accidentally. I'm just in the article. Okay, here we are. During the curfew, the Quebec government issued $31 million in fines. I guess, I mean, I know we've already been talking about this, but do you have like something specific you want to say about this, or just kind of a reaction to that obscenely high number?
It's the first time I hear the exact number, I think, or I didn't remember it, but I think it's really, it goes with what I was saying earlier, because I think there's too many tickets that were given during the COVID, I would say, prevention pandemic in Quebec province. And I'm not really sure how this is going to be useful for the health, for the public health of the province. But we do know that it's going to have negative impacts, especially on marginalized population, like racialized people, indigenous people also. Those people are usually more targeted by police in general, so they do have a higher risk of having those fines. So I think it's really concerning that we as a province chose to go this repression way to fight against COVID, actually.
And do you think that for marginalized communities where some of them may be lower income and maybe because of COVID lost their jobs, just have further financial difficulties, enforcing curfew, which can result in high fines, just kind of makes the situation more difficult for them to I guess pay their rent, exist, these things?
Of course, I think that the fact that we're going to have people being even more marginalized by the tickets that will be given because of the curfew, it will be harder for those people to meet ends in the end. And if you talk on an economical point of view, it's going to be hard, but also on the mental health point of view, it's going to be hard for those people. And I think that we didn't really, like the Quebec province didn't really take into consideration those people who are who don't really have a voice usually when it was doing their planification of health measures to fight against COVID, and we really need to do that. And actually, I think I could go to another point I wanted to make. It's that we do think at the League that we've been saying it for a while now, that the state of emergencies in Quebec should end. It should have ended actually a few months ago, a while ago. And because this state of emergency allows the government of Quebec to make decisions regarding health measures to be taken without having to be consulting with the National Assembly. And this is really concerning for us, because it means that those decisions are taken without being debated, without consulting the population or people, or without taking into account the opinions and the considerations of people who are really affected by those measures. So I think that with the so I think that it's really important to remind ourselves that yes, there's like this curfew and there's like all these measures that are repressive, but if there was this if we remove the state of health emergency, we would be able to discuss about it publicly, and this would be better for our democracy. And I think it would be better for the democracy in Quebec, but also for all those populations who are being repressed by the COVID measures right now.
Thank you so much. And I guess the state of emergency, it came into effect March 2020.
Yes, yes. So we've been in this state of emergency for almost 2 years now.
Okay.
And we do recognize that there's a need to act sometimes, and there's a health crisis right now, and we recognize that. But what the state of emergency does is that it kind of bypasses all the democratic processes that we have usually for anything that's related to the COVID pandemic. So it means also that it can affect the negotiations of work conventions for the people working in the health service. It can also have impacts on, I don't remember how to say it in French, so I probably don't remember how to say it in English. It also has an impact on des appels d'offres, like when the government, let me just check that out. I'm not sure how to say that in English. Like when the contracts that the government wants to give to individuals or to companies.
I know what you're saying.
The tender?
Don't know.
Is it a tender? No.
I have not heard of that before, but I can't even think of the word. But
well, it does have a lot of impacts on anything that's related. Like if the government wants to buy some masks, it's going to have impacts on that, and the National Assembly won't be asked to debate about this. So, and everything that's related from close to the COVID is going to be affected by this. And this is really concerning for the League right now. Even I would not say more than the curfew, because the curfew by itself is really concerning, but I think that the curfew is allowed because we are still living in a state of emergency.
So I'm just writing that point down quickly. Is the League trying to, I guess, push back against this state of emergency, or is there essentially anything anyone can do to push back?
That's a really good question. The League has written a declaration in May 2021 to ask the government to end the state of emergency. And the declaration has been signed by more than 110 organizations, like either a union or non-profit organizations, associations, etc. There's a lot of organizations in Quebec province that signed this letter. We've been writing to the government to ask them to put an end to the health emergency. But what can be done, actually, it's the government itself could choose to not renew it. And they are the one to have the power to not renew it. So we can ask for them to not renew it, but if they don't, they still have that power. So this is it's convenient for them, I think.
No, totally. Do you know is it like every March that they can choose to renew it, or what is
every 10 days? It's every 10 days. They've kept renewing it every 10 days. Every open days, let's say, like this doesn't include the weekends, but yeah, every 10 days since March 2020, they've been adopting decrees that renew the state of emergency in Quebec. So I don't know. You could try to calculate how many of them it's been since March 2020. There's a lot of them. I've stopped counting. Honestly, I've just stopped at this point, but it's a lot. It's imagine this for 2 years every 10 days. It's incredible.
I mean, of course, I'll do my research, but I'm wondering in what you guys have come across online, is the government open about this on their website? Is there much information?
Oh, that's a good question. I don't think they really talk about it a lot. And sometimes when they do talk about it, it's because sometimes some deputies from the National Assembly ask them questions. But what they say is that they need the state of emergency to adopt the health measures, which is false, because they could adopt those health measures, but with a debate in National Assembly. But they try to avoid the question usually. So they're not really upfront about it, and what are the impacts and how it's working, and what are the impacts on the democracy by itself.
Do you think adopting measures by through the National Assembly, does it delay things by too much?
It depends. We've seen this. I think it was in September when there was the vaccination passport. This was the first time, I think, since the beginning of the pandemic that there was some consultation regarding a health measure, and it happened really fast. I think they called some organizations to come talk at the National Assembly, and I think maybe a week or two later it was done. Everything was all the consultations were over, and it was done. So I think there's a way for the government to act fast when they want to and when they need to, and especially because there's a lot of we're not like in March 2020, so we can try to see cases rising. We can see the variant Omicron. We could have seen it coming because it was rising in Africa and then in Europe. So we knew it was going to come here. So we had the time to discuss those measures and how we would fight against it in the Quebec province. So there would have been time for the National Assembly to discuss it, actually. And especially because they are able to act fast when they need to.
Yeah. Yeah. On the note of the UK, I mean, I also saw that mentioned in the letter, and I spoke with a researcher who essentially he works on this study called iCare with other researchers, and they essentially grab data and people from across the world can participate in their study, which essentially looks at most successful sanitary measures to fight COVID. It's very interesting, but he was saying that we can predict what's going to happen in Quebec. I mean, not completely, but generally we can kind of predict what the numbers will be, because he said it's around 6 weeks what happens in the UK and Europe.
Oh, okay, interesting.
Which I thought was super interesting. But just kind of based on that, and based on what it says in the letter, I guess around that kind of 6 week mark, before things kind of got bad in Quebec, we were bringing dancing back, we were kind of loosening measures. Do you think that this should have been the time that the government should have been, taking note of what's happening on the Western side of the world, and just kind of maybe not loosening measures?
Mm-hmm. Well, I think you're kind of getting out of what we know at the League, because we're not really a public health organism. It's really, yeah, I think it would be easy for me to say they should have done this or they should have done that. I can say there's like everything that's related to our rights and democracy, I can talk about it, but like really technically about measures and how they should have worked, it's hard for me to say. So I'm not sure I can really comment on that. Yeah.
Not a problem. Completely understand. I guess, don't know if I have so much more to ask. I was gonna ask this, but it might be a little bit too healthcare measure-y, so let me know if you can't ask.
Okay.
But essentially, the fact that it also states in the letter, and I've also seen in my research, is that two of the largest places for outbreaks during the pandemic our schools and workplaces? And maybe do you think we could be able to avoid a curfew and the circumstance we're in if the government kind of just focused on where the main outbreaks are?
Well, it does make sense when you think about it, but I'm not really, again, I don't think I can comment really because that's not really our area of expertise.
Okay, not a problem. I guess, is there anything that I didn't ask that you think is important to keep in mind or want to
I
say?
don't think so. No, I don't think so. We've been really in depth, actually. It's one of the best interviews I did in the past months. So
Thank you so much. I know a lot of your time, so thanks so much for making